40 minutes. So Liz, if you could give me maybe a 5-minute notification when we
No problem, we'll do.
Thank you so much.
You got it.
So our objectives today are to understand the changes that have happened in healthcare, to understand the need for patient advocacy and the purpose of patient advocacy, how to influence people as a patient advocate, whether that's you as the patient or you're advocating for someone else, a loved one, and how to ensure a smooth admission, discharge, or transfer or transition of care, and also to understand the needs specifically within the pandemic that we're currently experiencing. So the evolution of care right now, the public perception of healthcare really has changed over the years. If you think back, if you're old enough to know, 40 years ago, things have changed tremendously as to how we view healthcare and how we view healthcare providers. There's much more litigation, and the internet, of course, provides easy access for anybody to become an expert in their own healthcare. So there's lots of people coming to doctors, nurses, nurse practitioners with lots of questions. There are also tremendous advancements in diagnosing and treating options that are unprecedented. Even 15 years ago, we did not have things like MRIs and CAT scans, and now pretty much everyone has that. Also, the role of the nurse has changed, and our providers has changed. We have nurse practitioners now, advanced practice nurses, physician's assistants, and that has changed the patient experience. Many times now, I'm sure many of you have experienced this, you make an appointment with your physician and you are seen by a nurse practitioner or a physician's assistant. They are very well qualified, but it's a much different world that we live in now. The role of the physician, a primary care provider, also has changed. We see many, many specialists. I joke all the time that we have a, let's say, hangnail specialist that can see you at the most fabulous Cleveland clinic, but that specialist knows all about your hangnail, but doesn't necessarily know about you as a human being, or you as a person, or your family, or your challenges. Also, concierge medicine is an outgrowth of the patient's frustration and the physician frustration. I recently, because of my husband's hospitalization, we ended up with concierge medicine physicians, which is a great option. And if you have any questions afterwards, I can talk about that. But it was interesting when I interviewed the physician that I go to now, she actually said to me the reason she went into concierge medicine was she was so frustrated that she had only 15 minutes to spend per patient. Can you even imagine getting a brand new life-altering diagnosis and you have 15 minutes to learn about it and 15 minutes for your doctor to talk to you? It's just really kind of unacceptable. So as advancements in technology have increased, you can see here that the spending per capita has also increased 31-fold in the last 40 years. And you can see here from 1970 to 2018, from $355 to over $11,000 per capita. Also, we're not as healthy as we used to be, believe it or not. The rate of alcohol consumption, obesity, and diabetes and heart disease has increased due to the stressful lifestyles we lead and our easy access to fast food. And obesity levels in the United States have increased from 13% of the population being classed as obese between the 1960 and 62 to 35% in 2005-2006, which I'm sure it's more now. And the diagnoses of diabetes has also increased from 23 million approximately compared to 22.4 million in 1964. So obviously we are requiring more health care as well. Demographics also increase or influence our healthcare need, and the number of Americans aged 65 or older is projected to nearly double from many millions now to 2060. And older adults are also working longer. You can see here the statistics in that percentage here. So also another issue is that we have a nursing shortage. As far as I've ever been a nurse, and it's been many, many years, we have had a nursing shortage for forever. And unfortunately, there we go. Unfortunately, it's not getting any better. Researchers project that 1 million registered nurses will retire by 2030, and that departure of such a large cohort of very experienced registered nurses means that a lot of patient care settings that depend on registered nurses are going to face a significant loss of nursing knowledge and expertise. So what we really have here is the perfect storm. We have a combination of fragmented specialty care, abbreviated physician visits, increasing costs of care, shortage of nurses, more demanding and educated consumers, increasing comorbid elderly population, and a very complex payment system. So again, the perfect storm. So this really impacts the patient's experience. Any of you, I'm sure all of you have been to a physician or a nurse practitioner, or perhaps you've been hospitalized or a loved one has been hospitalized. And really the vulnerability that you feel in the patient experience begins with that encounter or that event. All signs of our individuality are removed from us and we become, quote unquote, the patient, right? You've got that silly hospital gown that's flapping open in the back. I joked today with Liz that I wore my signature Dr. Birx, who does the White House coronavirus updates, scarf on today. But really how we dress, how we fix our hair, that all is part of our individuality. It's a statement about us. And when we become that patient, all of that is taken away from us, right? Loved ones' visitation may be limited, and we'll talk a little bit more about that in the age of COVID. And probing personal questions are asked, strangers are poking and prodding us. It is basically a humiliating experience. So there really is this need for advocacy, for someone to stand up for the patient and to speak for them and to make sure that they're well informed. The complexities of the healthcare system make it very challenging to effectively navigate the options. Some of you are navigators, and it's amazing to me that there are so many full-time people who help people navigate the system, the healthcare system. The patient and family are experiencing one of the most stressful events of their entire lifetime. The patient may lack the ability to speak up for themselves, maybe literally ability to speak, or maybe just feel somewhat intimidated. And the patient may not understand his or her rights. The patient and or the family may believe that speaking up can cause retaliation. I hear this very commonly as a nurse. If I say anything, they're gonna take it out on my husband, or they're gonna take it out on me as the patient. And that really should never be and isn't appropriate and doesn't really happen that I've ever seen. So what is advocacy? Advocates support and promote the rights of the patient in healthcare arena. They help build capacity to improve community health and enhance health policy initiatives focused on available, safe, and quality care. And in a fast-paced, fragmented, complex system, every patient needs an advocate. I have said for many years, if you go to the hospital, make sure you bring someone knowledgeable or capable to speak up for you. A good advocate can make the difference between a good outcome and a tragedy. I don't want to do too many sidebars here, but Liz mentioned that my husband was recently hospitalized. So I'll give you the brief story. He went in for an overnight procedure, surgical procedure. We went to one of the best hospitals, I will not say where, in the country, and one of the best surgeons to do this surgery. And we waited months for him. And it was supposed to be overnight, and I stayed overnight with my husband in the hospital, luckily. That evening, he started to experience problems. So urine output was poor. They were pouring IV fluids into him, and I kept saying, something is wrong, something is wrong. He started to have bruising around his incision site, and I kept saying, something is wrong, somebody needs to pay attention. And making the long story short, they did not listen. Within a week, I then said, he's infected, something's going on. And they kept telling me, no, he's not. I was actually told by the physician, why don't you stop thinking and just be the wife? So needless to say, finally, I demanded that he be transferred to the surgical intensive care unit, where he received phenomenal care. He was immediately found to be in septic shock. He had an infection in his urine, in his pelvis, and in his blood. And he skirted death that close, almost intubated. It was an ugly experience. The point is, and I'm not trying to necessarily toot my own horn, but had I not been there, he would have died. And we would have all said, well, isn't that weird how that happened? That's so strange that Neil was in the hospital and just for this one-day surgery, and what happened? So very important to bring an advocate with you. So what does advocacy really look like? When we advocate for ourselves and for others, we're making sure that we are heard. We're making sure that someone is really listening to our needs and listening to our concerns. We're able to make good decisions because we are well informed. If we're not getting the information that we need, how can we possibly make good decisions, right? Advocates do not make decisions for patients. They rather make sure that the patient has the necessary information to make their own decisions. Now, I will tell you that once my husband got to the ICU, I said to the intensivist, who has since become a good friend, that I felt, even though I knew he was very, very sick, that a weight was lifted off my shoulders. And the reason for that was because they made us part of the care team, which was fantastic, right? They were listening to us and they were acting on what the concerns were. So it really lifted a weight off my shoulders. So advocacy means that we open a two-way communication that is very vital to a successful outcome. I will tell you that the residents, when we were on the regular floor, were very dismissive of my husband. They were very dismissive of any of our concerns. They did not even make eye contact with us. It was outrageous. So there was no open two-way communication with them. Active listening on the part of the caregiver is a proven effective treatment modality, obviously, and the patient and family need to have confidence in the care team. When my husband was on the floor, we did not have confidence in that team. Really establishing a relationship of mutual trust is essential. When we think about it, let's say you're going for surgery. You are now going to be unconscious, and you are now putting literally your life into the hands of a person you just met. You better have some mutual trust there, right? In advocacy, knowledge is power. Read and become familiar with the Patient Bill of Rights. If you don't know what that is, you can Google it, or afterwards I can send it to you. It should be given to you when you go to a hospital or to a post-acute care facility. Know how to contact an ombudsman, the State Department of Health, or Centers for Medicare and Medicaid Services. I think we all know how to contact them now, right? And we don't want to set up an adversarial relationship with any of these caregivers, but we want to be, again, part of that team. If they are not listening, excuse me, we need to know how to contact people that can help us. So what should you expect as a person who interacts with you as a caregiver? What should you expect? They should show respect to you and to your loved ones. They should introduce themselves. They should be wearing a name badge with their title, so you know who they are. How many times have you had people walk into your room and say, hi, blah, 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 I'm going to do this. Who are you? What are you doing? They should inform you of their names, the names of your medications that they're giving to you, the actions, the side effects of the medications before administering them to you. They should check your ID for your name, your date of birth, and any allergies. And this was created before COVID, but certainly important here. They should cleanse or wash their hands before touching you or any equipment in your room. And a lot of times you'll see in the spaces in the emergency room or in the hospitals, it says, ask me if I wash my hands. Have you ever done that? Sometimes you get some interesting answers. I wash my hands. But you have the right to know whether that person did that or not. Again, knowledge is strength in that power of advocacy. Educate yourself as to what's the best doctor, what's the best hospital for this procedure that I'm about to have, or for this diagnosis that I have. What questions should you be asking? That's where a knowledgeable advocate can come in to be helpful to you. I do this right now. I am doing advocacy for free during this COVID period of time. So if you have questions and you want to contact me, please do this. But this is part of one of our services. I have a friend right now whose 19-year-old son is hospitalized, who had a seizure, had fevers before this, is COVID negative. And she also is a nurse, actually, but she is so stressed out, and she's asking me, what do I need to ask? And I've sat down with her and said, remotely said, write down these questions. Ensure that your medical history and medication list is accurate. Interesting experience with my husband is we were in the same hospital setting, and afterwards we went to we had several specialists because he had multiple complications. And I thought, how am I going to, after he went home with a lot of lines and IVs, and I was able to do that as a nurse, but who was I going to call on a Thursday evening if he was having an issue? I'd get a medical resident or an intern, they wouldn't know anything about him. So that's when we hired the concierge medicine physician, which was great. But interestingly enough, post-op, when we went for our follow-up appointments, everybody was in the same hospital system, but all of them had a different list of his medications. It was amazing to me. Some had inaccuracies in one that didn't match the inaccuracies in another. So have your list typed out, prepared, carry it with you, make sure it is accurate, and make sure you take the time to reconcile that list of medications with your provider. Bring a knowledgeable healthcare provider to your visits if you can. I will tell you that one of the things that we do as part of our business is have people attend doctor's visits with people who might be elderly. I'm not a good auditory learner, so when I write things down, I remember them, but I don't always remember everything that I hear. So it's important for me to have somebody with me or that I write things down. I know I've gone before with my mom to appointments. She went to a pain management doctor and for her hip, and he walked in and said, "Hello, Mrs. Young, you're having some pain?" And she said, "No." And I said, "Mom, that's why we're here." Had she been there alone, she probably would have come home and said to me, "That doctor didn't do anything for me." So that's one of the services that we provide. Also, being stressed, as we know, reduces your ability to learn. Imagine getting a brand new diagnosis that's life-altering. Do you really hear anything after that? But if you have an advocate with you, very important that they can listen. It also takes the onus off the patient. And what I mean by that is if I'm the advocate and I'm asking these probing questions that might be a little bit tweaking those folks that are taking care of the patient, I can play bad cop, she can play good cop, or he can play good cop. Advocacy is influence. So before we get into the COVID part, I want to talk a little bit about how to influence people. And one of the most profound books ever written on how to influence people is Dale Carnegie's How to Win Friends and Influence People. It was written in the 30s and it remains one of the best-selling books of all time. And of course, you probably know that there are programs that you can go to for a full week to learn how to influence people, the Carnegie method of influencing people. So I want to begin here just with a few bullet points that would be helpful as an advocate to influence people so they're going to listen and take action so that we can receive the best possible care. So he starts out by saying, how do we handle people? First, we want to gather honey. So if you want to gather honey, don't kick over the beehive, right? You don't want to start out being confrontational. I had an experience with one of my clients recently where a nurse called, and in this age of COVID, quite frankly, everybody is learning as we go along. There are some proponents or some tenets, I should say, of infection control, but there are many things that we are learning as we go along. And one of the physicians, a medical director, wanted them to do some kind of nasal spray, like an Afrin nasal spray. And there was I could not find any scientific evidence to do this. So I was asked, never met this woman, I was asked to be the one to call her and contact her. And never having met her and confront her basically about this new policy that she wanted to institute, these new medical orders. So instead of saying, "What are you thinking? There's no scientific evidence behind this," that would have made an immediate enemy. I started out by thanking her for working so hard and being our medical director in this facility during this time of the COVID outbreak. That softened what we had to say. She appreciated that. She was open to listening to me. So it was a lot different than if I had started out accusing her of anything. And we have since become good friends. Begin in a friendly way. Again, people don't want to change their minds. They can't be forced to agree with you, but maybe if you're gentle and you lead them in a friendly manner, you can help them. So there's an example of the wind and the sun. And they're talking to one another and they see a little old man sitting on a park bench and he's clutching his winter coat. And the wind said, "I bet you that I can get that guy to take his jacket off, his coat off." And the sun said, "Fine, go right ahead." So the wind starts blowing really hard and harder and harder and harder. And the little old man just clutches more strongly to his coat. So the wind finally gives up and he says, "Go ahead, sun, see if you can do anything about this." And the sun just gently, gently begins to warm the little old man sitting on the park bench, a little warmer, a little more gently. And finally, the man takes off his coat. And the example, of course, is that if we lead in a gentle way, oftentimes we get what we need rather than being forceful. Also, criticism creates great defenses. We really don't want to criticize, condemn, or complain. So criticism really puts the other person in the position where they have to defend their pride. Had I said to that physician, for example, "This is wrong. This is just wrong. You can't do this nasal spray. It's wrong." She would have felt, even if she listened and realized she might be wrong, she has to then protect her pride and her sense of importance. and it would just arouse some resentment in her, and she would have had to defend her position, okay? So when dealing with people, remember, we're not always creatures of logic, but oftentimes by emotion, and we're motivated by pride and by vanity. Any fool can criticize. It really takes character and self-control to be understanding. Also, appreciation brings cooperation. So give honest and sincere appreciation. And I sincerely did appreciate what this physician, this medical director, was doing really in the trenches there in a facility where they had an outbreak of COVID. So really, the flattery is telling the person what the other person thinks of himself, which I think is kind of funny. But appreciation really is the legal tender that everyone enjoys. We all yearn to be appreciated. So as a patient, or as if you are an advocate for your patient, what are the responsibilities that the patient really has? We talk a lot about what the medical professionals need to do, but what is the patient's responsibility? As a patient, you have to be honest when reporting symptoms or providing a medical history. You have to be an active participant in your own care planning and recovery. You have to treat the care team with respect. I meant to add a slide in here of the percentage, the amount of nurses who are actually assaulted in their roles. It's astronomical. It's outrageous. Most nurses will tell you of stories of times that they have been threatened or they have been assaulted. And I'm sure that Emily can probably tell you the legal aspects of all of that, but it's really becoming a problem. It's not okay to be disrespectful. You need to meet your part of the financial responsibility, of course, and you need to comply with the agreed upon treatment. You have to remember too that people are under high anxiety. So I also teach this program to nurses and physicians. It's a different program, but looking from the perspective of the patient and the family. As I told you, my friend has a 19-year-old son who's now hospitalized in the intensive care unit. Can you imagine her level of anxiety right now? So depending on the circumstances, an event can create that high anxiety, and sometimes when we're stressed, we may lash out in anger. So understanding that from the caregiver perspective, we need to realize, but again, it's never okay to try to physically lash out at someone. You have the right to ask, to question, and to request. If you're unsure about anything, ask. It won't be stupid. You need to ask questions. If something doesn't seem right, question it. If your needs are not being met, request what you need. The staff will not be upset if you ask, question, or request, as long as you remember to do so with respect and without criticism. Remember that drop of honey, right? I want to mention too the transition of care. So shortly after admitting, if you are advocating for somebody, and we are going to talk about COVID, I promise you, just in a moment, but shortly after admission, you really need to schedule a time to sit down. Let's say you're going into, you fractured a leg in a skiing accident, that would be fun to ski, and you are now having to go to rehab. You really need to sit down with the nurse and or physician and review the following. A complete list, again, of those medications and treatments with dosages, routes, and frequencies. Reconcile any changes. Many times when people have surgery, some medications are held, and you want to get back on those medications if they're appropriate in the post-op period of time. Individuals, the individual needs to be added to your care planning, and how you will communicate with staff. So for example, my friend now who has her son in the hospital she is the point person. When my husband was hospitalized, there were many people. He's a dentist, he has lots of patients, he has lots of staff, he has lots of friends, and they were all calling constantly. And I was trying to be my husband's advocate. So we created one point person with a lot of his friends. So where he is in choir, his staff, there was one point person that talked to me each day and got information. Have a list of individuals who can be called if there are any concerns, exactly what I just said. So set up a follow-up meeting with the heads of the unit and department for no more than 1 week after admission, just to kind of regroup and make sure that things are on the right track. When you're prepared for discharge, start to think about what support systems you need when you return home. And don't wait until the day before discharge to get prepared. Really, discharge preparation begins the day that you arrive at the hospital or the post-acute care facility. Ask for referrals as needed before going home. There are options for skilled or private pay home care. durable medical equipment such as wheelchairs, walkers, and IV supplies. I know when my husband was discharged, they said, well, we'll send the walker to your house the day he's discharged. And I was like, well, then how do I get him home? Because he couldn't walk at the time. He needed a walker. Oh, okay. Adaptations at home, such as ramp and grab bars, those have to be installed prior to getting home. And ensure that any teaching needed at home is begun as soon as possible. They should be teaching you in the hospital setting or the post-acute care setting before you leave. So finally, COVID. How has COVID-19 changed advocacy and communication in our world right now? Probably you know this, but maybe you do not. Right now, there are no visitors allowed into hospitals or post-acute care facilities. So just imagine if your loved one is hospitalized. So think about this young woman whose 19-year-old son is hospitalized in intensive care. She cannot enter the intensive care unit. She cannot be there with him. So not only is that distressing for her, it's distressing for her son. The patient has to rely upon hospital nursing staff for all needs, be they physical, emotional, or spiritual. Advocates have no firsthand access to the patient, resident, or their medical information. And care providers also, when you think about that side of it, are overwhelmed with increased responsibilities. We've all heard PPE, the personal protective equipment, the use, the cost, the supply, the fear of contracting the virus, the fear of bringing it home to your family members. They are the emotional support for their patients now and for one another and for themselves. They get a high volume of calls from highly stressed patients and family members too. So my friend told me a story that she called, he was at a local hospital. I since advised her to move him to a main campus downtown in one of the big hospitals. But the local hospital, she called in and she wasn't overdoing the calls. She wanted to know how her son was in intensive care. And the secretary said to her, stop calling here. You can't call here, I'm too busy. Unbelievable, right? So try to have your questions and your calls ready when you do go ahead and call. But because those people that are caring for your loved ones want to spend most of their times with your loved ones. So be prepared. Anyone can get sick with COVID or any other illness. In fact, you're much more likely to get sick with some other illness besides COVID, quite frankly. Have a signed HIPAA release and a power of attorney for family members. We have some attorneys on the phone call. I'm sure they can be of help to you to get a POA signed for your family members. So for example, my son, that Liz knows very well, is out there working. He does heating, roofing, and air conditioning. And he is being safe, but he is out there in the public. He has not come to see us because he doesn't want to get anybody here sick, especially after my husband was hospitalized. But if he became ill, I cannot go into the hospital to see him, right? So do you have a power of attorney? How would I be able to get information if he were not conscious, God forbid? Have a plan for communicating with loved ones if hospitalized or sick at home. So if my son Matt were sick at home, how am I communicating with him, right? Probably via Skype, via Zoom, whatever. Designate a point person for communication with medical staff and family and friends, as I mentioned before. You don't want several family members calling the hospital asking how this person is doing. Have them direct their questions to you, and then you talk with them. Prepare written questions ahead of your calls to the medical professionals. Again, how many times have you left a doctor's office and said, I forgot to ask this question? If you have everything written down ahead of time before you call, or when you anticipate their call, then odds are you're not going to have that, oops, I forgot question to ask a question. And finally, contact a skilled advocate. Somebody like myself, nurses, I know you know that you get those kinds of phone calls all the time to ensure that everything possible is being done and done accurately. Ask about the COVID isolation procedures used in the facility. So this could be post-acute care skilled nursing. It could be the hospital. Be familiar with the CDC guidelines, and I'm sure most of you are, but there's a link here to coronavirus.gov, and there's a wealth of information there. All staff working in a facility, you should know this, with positive cases of COVID must wear N95 masks at all times. So that's a question you might want to ask. Is everyone there in the facility wearing N95 masks? How many cases do you have in the facility? The county boards of health may restrict admissions and discharges in the nursing homes. So I am working with one client that has an outbreak, and Indeed, they did restrict admissions and discharges from that home, the county board. New admits are quarantined away from the general population for 14 days. Ask questions. Is that happening? Yes, they are required to do that. Are they doing it? Positive or presumed positive COVID patients must be isolated from other residents and patients. So how have they set that up? You know, everybody has scrambled to get this done literally within a week or less. So are they isolating, and what is their isolation procedure? So discharging during COVID, the Ohio Department of Health statistics on the nursing home COVID cases is being updated, but it may not be currently accurate. Quite frankly, on a daily basis, we are being updated by CMS, and that's part of my responsibility as a consultant to nursing homes and hospitals to make sure that they are updated. And they are now, as of today actually, sending out guidance for how they want these cases reported to CMS. They are reported to the county board already, but that does not necessarily get up to CMS. So those cases will be reported and tracked, and you will see data on their websites. If in doubt, don't hesitate to insist on a transfer to another location. I told you the story about how I insisted my husband be transferred to the intensive care unit. He would probably have died in the lovely, beautiful room he had there. I also told you how I advised my friend to have her son taken to a larger facility hospital where they have a neuro-intensive care unit where this child was having seizures. Get clear information on isolation or quarantine after discharge. So if I've been exposed to COVID, but I don't have symptoms, what do I do when I go home? Maybe there's someone who's immunocompromised in my home. What do I do? Ask for that kind of information. Know how to use good infection control techniques in your home. See my LinkedIn page. I have a link here, and I posted, I think, about 4 or 5 blogs there, posts there about things that you can be doing in your home to prevent COVID from entering your home, because we still have to go out and get groceries and do those kinds of things. And finally, I want to say that we need your help. I was really heartened to hear some of you talking about how you're helping out there. Most post-acute care facilities are functioning with their usual staff. Most of them do not have outbreaks. However, the stress of added precautions is very taxing. Some facilities are experiencing staffing struggles due to resignations, no-shows. Some people are panicking. They don't want to show up to work. And also there is some illness of staff. There's lots of overtime. Lots of the staff members are not getting breaks. They have difficulty obtaining meals. You can't really, go out for a meal. And all of this adds to their stress. And quite frankly, what I am seeing is it's not so much in the hospitals. If you notice, they're laying off nurses in hospitals, but the nursing homes are struggling mightily. And that is where the most vulnerable population is and where it's most challenging for us to find staffing. So how can you help? Do what you can to support your local nursing homes, assisted living facilities, and the seniors in your community. The facilities that do have breaks need meals sent in. They need staff. So a lot of the licensure requirements have been waived by CMS. So what I mean by that is graduate nurses, registered nurses or LPNs, even though they have not sat for their boards yet and are licensed, are able to work. Aides, we can get aides from, they usually go through a program, a course to be in a test, but we can do an 8-hour course with people that, let's say, are working in the hotel industry and they're out of work right now. If they are interested in helping, the staff would love that. And they are not putting them in the COVID units, the isolation units, they're putting them rather where there is no COVID so that they can free up those staff members to work with people who are positive COVID cases. Supportive acts of kindness are much appreciated. Some ideas, one florist sent all of the staff and resident flowers in one of the facilities that I'm working with that had an outbreak. I can't tell you how much that helped. Send in meals for shifts. Volunteer to help on non-COVID units, visit outside facilities. I have a group that I'm working with right now, and if you're interested afterwards, email me and I'm happy to tell you about this, but we're gonna be doing like a line dance and some music outside the windows of some of the facilities and holding up signs, that we care about you. It really makes a difference to those residents who cannot see their loved ones right now. You can also write cards or letters to the residents and to the staff. I think it'd be really neat to have kids do this too. And in summary, remember that advocating for yourself, or for a loved one is an essential part of your care. You or your advocate must make sure you are really heard and that your individual needs are being met. Be informed, be respectful, and be firm while adding that drop of honey. And having an advocate, as I say, can make the difference between a great outcome and serious or even tragic consequences. So with that, I thank you. And I have my contact information here on the final slide. And if we have time, I'm more than happy to take any questions that you might have.